Video 12. Structural back pain, triage and treatment. There are, of course, many causes of back pain. However, the majority are non-pathological. Good case history taking, clinical examination, and when appropriate, imaging and other tests should exclude sinister pathologies that preclude treatment. Progress during treatment is measured subjectively with symptom progression and objectively with lesion progression. Ideally, lesion clearance is achieved at each treatment session and the lesion location changes between each treatment session, i.e. lesion progression. Sometimes on the first session, a second treatment is required to clear the same lesion. However, ideally a new lesion will present each time until the pelvis and lumbar spine are clear and the symptoms are resolved. These changes in lesion location would appear to represent genuine structural change. These lesion layers may have been laid down over time with impacts and insults to the body. These layers require time as well as treatment to strip away. At least a week, if not two, is required between treatments. It would seem then that a process of unwinding of the ligaments and fascia need to occur for lesion progression. Most people will have 2 or 3 layers, but sometimes 4 or 5. When all goes well, this will reflect in a similar number of treatments. Once the sacroiliac joints and lumbar facet joints have been cleared, the symptoms should be resolved as well. Once someone has been through this process, their pelvis should be more of a blank slate, as it were, and should be quicker to treat in the future should they have any problems. A session or possibly 2 should be all that's required. If there's been no significant impact since the initial course of treatment, the McKinnon technique may well be sufficient to clear the lesions. When one first starts treating this way, the main blocks to lesion progression, symptom progression and general success is the fundamental difficulty in palpating and manipulating the sacroiliac joints. It took me about 5 years of dogged determination before I went up the steeper part of the learning curve. I hope it's quicker for anyone else trying to follow this path. Lesions may be missed when palpating at the beginning of a treatment, but more so when palpating after manipulation. If a lesion requires 2 cavitations to clear, it will often feel somewhat freer after the first cavitation. This apparent improvement is particularly true of the S1 complex, which will often need a 3rd or 4th cavitation for joint clearance. If this is the case and joint clearance is not achieved, the same point will still present again at the next session and no progress will have been made. It is possible to clear a joint and for it to lock up again by the next session, but given there is proper clearance at the end of a session, this type of recurrence is often realized around the 4th session when we would be expecting lesion resolution and symptom resolution. In this situation, lesion location progression occurs on each session, but on the 4th session or so, one of the previously resolved lesions locks up again. I call this going around in circles. At this point, the patient should be reassessed on all levels. Further tests and investigations for occult sinister pathology might be appropriate. Maybe a longer-term rehabilitative approach is required, involving an individually tailored exercise program and episodic treatment. Perhaps some other form of therapy might be more appropriate. It's clear from research that not all non-pathological back pain is structural. Different people respond to different treatment techniques and different practitioners. However, I believe that a treatment approach that involves the application of the techniques outlined in these videos is the most effective. Although mastering this is particularly difficult, it is well worth it.